Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What is the mechanism of action for Quviviq? Quviviq is a dual orexin receptor antagonist, DORA, insomnia medicine for adults that works by blocking orexin receptors. Quviviq turns down overactive wakefulness by blocking orexins, which are chemical messengers in the brain that promote wakefulness. It may be prescribed if you have trouble falling or staying asleep. How does Quviviq work for sleep? Quviviq works in the hypothalamus, a part of the brain, by blocking the receptors OX1R and OX2R. The neuropeptides Orexin A and Orexin B bind to these receptors to promote a wakeful state. When Quviviq blocks these receptors, the neuropeptides cannot bind to their receptor sites, which helps with sleep. Can I take Quviviq every night? Unlike some drugs used for insomnia, you can take Quviviq, generic name, daridorexant, every night over the long term if this is how your healthcare provider prescribes it, but don't take more than prescribed. Quviviq usually works within 30 minutes after you take it. It may take longer for it to work if you take it with or right after a meal. It works throughout the night and can help you fall asleep and stay asleep. Do not take this medicine unless you are able to stay in bed for at least 7 hours before you must get up and be active again. People usually start to sleep better after about 1 week of treatment and continue to improve over that month. In studies, Quviviq helped people with insomnia sleep better for at least 3 months. Call your healthcare provider if your sleep worsens or is not improved within a week to 10 days. It's important that you know in some cases your awareness or alertness may be decreased in the morning after taking Quviviq the night before. In some cases, you may feel drowsy for several days. This can be dangerous, especially if you need to drive, think clearly or perform other hazardous activities. You might feel sleepy during the day too. If this occurs, report these side effects to your doctor. If you feel drowsy or unsteady in the morning, do not drive, operate machinery or perform other hazardous tasks. Usual Quviviq dosing. The usual adult dose of Quviviq for insomnia is 1 oral tablet at bedtime. It works quickly, so it's best to take it within 30 minutes of going to bed, with at least 7 hours remaining before you plan to wake up. Quviviq comes as a 25 mg or 50 mg oral tablet. Do not take more Quviviq than prescribed by your doctor. You may not be able to use Quviviq, or you may need a dose adjustment, if you take certain medicines or have liver disease. Tell your healthcare providers which medicines you take, including prescription, over-the-counter, OTC, vitamins, and herbal or dietary supplements. Quviviq is classified by the DEA as a Schedule IV federally controlled substance because it does have some potential for misuse or abuse. Studies have shown that it causes withdrawal when it is stopped. Do not take it with other sleep medicines or medicines that might make you sleepy unless approved by your doctor. It is not known if this medicine is safe and effective for use in children. Related questions: Quviviq versus Ambien, how do they compare? What is the maximum safe dosage for melatonin? Can you have narcolepsy and insomnia? Does Quviviq cause side effects? In studies, the most common side effects with Quviviq were headache, in 7% of people studied, and sleepiness, in 6%. Other side effects included dizziness, 2% to 3%, and nausea, 3%. Rates of side effects were similar for both the 25 mg and 50 mg doses. Quviviq is well tolerated by most people who use it. This is a newer medicine, first approved in 2022, so longer-term side effects are not as well described. Quviviq may also cause complex sleep behaviors such as sleepwalking, sleep driving, talking on the phone, making and eating food, having sex, or other actions while not fully awake. In some cases, you may have no memory of these activities. Stop using this medicine and contact your doctor right away if this side effect occurs. Serious side effects such as worsening of depression or suicidal thoughts or actions, sleep paralysis, an inability to move or speak for several minutes, and hallucinations, which may be vivid and disturbing, may also occur. If you experience these side effects, contact your doctor right away. Other reported side effects with this class of drugs include cataplexy-like symptoms, may include periods of leg weakness lasting from seconds to a few minutes. Can I drink alcohol with Quviviq? No, do not drink alcohol while taking Quviviq as it can increase the effects of alcohol, which can be dangerous. Combining alcohol with Quviviq can increase drowsiness, lower your alertness, and affect your balance. Sleepiness during the daytime may also be increased. Using Quviviq with other central nervous system, CNS, depressants, for example benzodiazepines, opioids, or tricyclic antidepressants also increases the risk of CNS depression, which can cause daytime drowsiness or impairment. Quviviq is manufactured by Idorsia Pharmaceuticals. Learn more, Quviviq versus Ambien, how do they compare? This is not all the information you need to know about Quviviq, daridorexant, for safe and effective use and does not take the place of your doctor's directions. Review the full patient medication guide and discuss this information and any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.